It is Monday, 9:45, which means it's time for The True with Dr. Drew. And this is week 2. Welcome again, Dr. Drew.
Thank you for having me.
Well, thank you for being here. Over the next 5 more weeks, we're going to talk about dental hygiene. But one of the greatest reasons people don't go to the dentist is, I'm scared.
Absolutely. There's a lot of different reasons for that. Certainly the most common thing is for people that have had negative experiences when they're kids. Dentistry was very different several decades ago, and I hear stories about kids being held down in the chair, not being frozen, even slapped by their dentist, and that has stuck with them basically for their entire adult life and often ruined them for dentistry for many, many years.
Now, what has changed in, I guess, more modern or contemporary dental practice?
Well, I think that there's a sense of compassion that most of us have that frankly, we weren't even taught in dental school, but understand that that's really probably a better way to get through the procedures. But also, getting through the procedures with someone is one thing, but trying to train them or want them to come back to maintain oral health for a lifetime is really the goal. Freezing is certainly a lot better than it used to be, and I hear lots of stories about dentists who, quote unquote, didn't believe in freezing for kids. Well, kids feel things the same way grown-ups do, and they remember for a very long time. So yeah. That's a big part of it too.
Well, I remember just a number of years ago, for the first time going to see a dentist, and when they had called to confirm the appointment, his staff had said, "Bring music you like."
Yes.
And I said, "What are you talking about?" They said, "Well, this might be about an hour procedure, and you might like to listen to music that, will soothe you."
Sure.
I had never experienced that.
Whatever distraction works for the individual is great. So we have lots of patients who bring in their own headphones and listen while we're working. We have TVs in the rooms that, again, serve as another form of distraction. So anything that works to help take your mind off of what's going on, especially for someone who's really anxious, is a great thing.
Well, I'm a few years older than you, Dr. Drew, and I remember being in school, and you're maybe 8 or 9 years old, and it may be when a lot of these dental experiences happened for me as well, back in the early 60s, of being hit by a teacher.
Right.
And I would go home and say to my parents, "A teacher hit me," and the first reaction would be, because that was the era, "What did you do wrong?" Right. And I know that a great deal of dentistry in those days, part of that fear was really shame-based.
Exactly. I'll relate a story that we talked about earlier. I had a patient come into the office not too long ago and talk about her experience at another office where certainly she was anxious about being in there. She was embarrassed herself about the condition that her mouth had gotten into, but she had a visit with another dentist, and they brought a child into the room and said, "If you don't take care of your teeth, that's what you're going to look like," pointing to the adult. And clearly that didn't put her in a frame of mind to want to take care of the issue she was dealing with. The truth is, we're supposed to be a place of healing and help. And so when someone comes to see me for help, I think that's what we should be taking care of first. We can certainly go through an education process to help prevent future issues from happening. But first and foremost, we want to be a caring environment to take care of people's problems.
Well, it's funny. It was on my mind, and I had written this down over the weekend. It's, I guess, by the time someone comes in to see you and you have assuaged their fear of being there in your office, what's good practice for us each and every day to continue good oral hygiene?
Well, certainly when we have patients coming in, it is a partnership. We can take care of the needs on an ongoing basis, every however many months that is that they come in for routine care. But yes, absolutely, taking things from a home care standpoint is important. And so certainly there's brushing technique and flossing and those sorts of things that we've all heard about and sometimes have a hard time fitting into our routine. But there's a lot of other tricks, whether it be a hydrofloss or water picks that help stimulate gum tissue and irrigate things that maybe are a little easier for people to fit into their routine. So there's absolutely a lot of other techniques that can be used to help.
Because I remember, as I mentioned this just a little while ago, when I was young, we didn't know anything about floss.
Sure.
And I guess it was maybe the 80s it started to come into fashion, and then absolutely, a daily routine.
Right. And, another week I'm hoping to talk in more detail about the relationships between your oral health and your overall health. There's a lot of studies that are showing relationships between gum disease and things like cardiovascular problems, diabetes. And so we're seeing a much bigger picture as to why it's important. Yes, we obviously want to eliminate getting decay and fillings and avoiding root canals, but there's a much bigger picture that's going on, that overall health, we're seeing all these links going on, and so we pay very close attention to that.
Now, are there certain foods that we should avoid that might cause a more a faster breakdown of certain things in our mouths that we could just avoid by not eating?
Well, dental decay really is a simple process. It requires three things. It requires teeth, it requires bacteria, which we all have in our mouth, and it requires sugar. So basically, sugar is the key to all of this. And not everyone is the same. I often have parents come in that are frustrated that they have one child and they're having a lot of decay issues and another one that isn't. And I had the same thing in my family, where I have one son who was always the healthy eater, who didn't really get involved into sweets, and he actually was the one that had a lot more dental issues. Whereas the other brother, who likes to hide candy in his room, didn't have the same issues. So when you're dealing with sugar, it's not the same for everyone. The other main issue is the frequency. And so when you look at, say, teenagers, sports drinks are something that's getting a lot of publicity now in terms of their ability to cause decay because they are high in sugar. And so if you were to chug one after a workout, as far as your teeth go, that's not such a big deal. Your saliva has a chance to remineralize what's going on. Whereas if you're sipping it and nursing it all day long, that for your teeth is terrible, because it's going to lead to a very fast, as you were asking, that can really increase the rate of decay.
Now, I remember going through a root canal, and it was a horrendous experience. But the doctor had mentioned to me, "Do you drink a lot of coffee?" And I said, "Well, I have coffee in the morning." And he said, "Drink tea instead. It's better for your teeth." Now, is this a fallacy?
No. Coffee, usually the issue with coffee is if you're putting a double into it.
Right,
the coffee itself isn't going to do it. And tea actually does have some antioxidant characteristics, and so from your gums that can provide some benefit there. And people tend to use a little less sugar. It also is, I believe, less acidic. So there is some truth to that.
Before we run out of time, how can we personally deal with our past experiences, muster the courage to come to see you and your staff? I mean, like I said last week, I've been there. It is a warm, welcoming place. But for a person who's negotiating, I have to see a dentist.
Sure.
The pain is brutal. How can we, assuage our own being blocked from going?
We certainly cater to the individual as to what level of help they need in getting through that. So we have some patients that we bring in just for a tour, and I'll say hi and that's it, so they don't have to go through the fear of actually sitting in a dental chair. For some people, once we've had them in, we'll talk about different levels of sedation, where, just putting them in a different frame of mind, as far as sending them to another office where they can, be put under so that they don't recall things. Now, we try to avoid that where possible. We like to communicate and have people understand what's going on. And frankly, I think because my team is so great at understanding and recognizing the signs of anxiety, we have a lot of patients that have turned around and said, wow, I really didn't think I could ever get to a point where I enjoyed coming to the dental office, and they do. So we kind of take the individual and figure out what it is that they need. And
that's part of your mandate at your practice.
Absolutely.
Making sure that all your staff are on the same page in terms of how you approach each and every client.
Right. We've had a lot of training within the office to deal with complex cases, and often people feel like, well, I'm going to be the worst patient they've ever seen, or there's nothing that can be done to save me. Very often there is.
Yeah, the thought, and I as you mentioned this, I had a recall here. I don't know if it was a repressed memory or not, but actually being stiff and having like a paroxysm, just being in the chair. And I know that practice has changed, and there is a more compassionate approach.
Sure. And the worst story I've ever heard was a patient whose father was a dentist and abused her in the dental chair. And, it was so difficult for her to be there. She would cry while she was in the chair. It's a very vulnerable place for a lot of people that have different histories. And so we just lend a reassuring hand and allow the people to feel what it is that they need to feel to get through that visit.
Thank you, Dr. Drew. You've been listening to The Chew with Dr. Drew Markham. Dr. Drew will be back next Monday at 9:45. Thank you. I feel better already.
That's great. Thanks.